Hey everyone, I'm your host Cadence, and welcome back to another episode of Project Honesty. This is a podcast by a young adult, for young adults, to acquire unfiltered advice and bold opinions, as well as take deep dives into the issues shaping our world. We'll challenge ideas, explore new perspectives, and have fun while navigating the ups and downs of life. This is Project Honesty, where truth meets curiosity and every conversation matters. If you haven't already, go check out last week's episode. I guess I shouldn't say last week. It uploaded on Saturday, which was yesterday because I record this every Sunday. Yesterday's episode called, 2 days ago episode, you know what I mean, called Permission to Pause, Learning How to Manage Mental Health, Burnout, and Taking Breaks. Navigating mental health can be messy, and that's okay because, surprise, we are human. In this episode, we aren't here to sugarcoat it. Instead, we're here to talk, feel, and navigate the sometimes confusing and heavy journey that is mental health and the human experience. Tune in to find out more. That is available on Spotify and YouTube. Before I get into today's topic, I want to deliver a little bit of a trigger warning. Today's content will be a little bit disturbing, a little heavy, not details of victim stories, but describing victim stories and details and allegations of sexual abuse. Because today we're going to be talking about sexual abuse in the medical field, a case in the media that was long-standing but has been a good learning opportunity for the medical industry as a whole into sexual misconduct, and overall why this industry can be susceptible to hidden abuse. So starting off with a general question, why is sexual abuse and misconduct something that can happen quite frequently in the medical field? Well, first, there's a power imbalance. Doctors and medical professionals hold a lot of authority because, we trust them. They are our caretakers in our time of need, and they typically solve the problems when we are sick. And when someone, the patient, is in a vulnerable state, sick, scared, or needing answers, it's easy for that provider to be seen as all-knowing and trusted without question. So these abusers can exploit that power dynamic, knowing their patients feel too intimidated or unsure to speak up. Number 2, is the private and intimate settings of clinical rooms. This increases vulnerability and therefore opens the door for abusers to take advantage of that vulnerability. Medical exams, specifically in athletics, can sometimes involve undressing, most of the time physical touch, and a lot of confidential discussions. These are all things that require an immense level of trust with your healthcare provider. Yet, abusers can still use this context to cross boundaries under the guise of medical necessity, especially if the patient doesn't fully understand what's normal or medically appropriate. You'll notice that there is a big theme of patients being taken advantage of, especially in the case study that we're going to go through later. Again, going back to the state of vulnerability. When you are in a confused, wanting answers state, it is very easy to just take the first thing that is thrown at you. And that is something that, I don't want to say many, but there have been cases of medical professionals taking advantage of that. And then on top of this, there's a lack of witnesses and oversight, because these exams are often done one-on-one without a third party present. Some clinics and hospitals have chaperones or protocols for these kind of things in place for certain intimate exams, but not all do. So there is rarely ever a baseline for third-party oversight into intimate exams. And the absence of these witnesses can make it harder to prove this misconduct and makes the victims feel isolated in their experience because of lack of understanding and empathy. In those situations, it's about really hearing the victim and listening to their experience and story rather than trying to disprove them immediately. Because there are so many things that can happen behind a closed door that we're unaware of. And it makes the situation more difficult when these kind of sexual misconduct situations happen behind a closed door. Number 4 is institutional resilience. So medical institutions, like many other powerful systems like corporate systems, sometimes will prioritize reputation over accountability. So these cases get buried, the reports get ignored, and we'll see examples of that in the case study later. Or victims in general are made to feel like they are misunderstood of what happened. And there's a recreation of narrative that is filled of victim blaming and shaming and gaslighting and manipulating this victim into thinking that didn't happen. And this creates a culture where perpetuators can act repeatedly without consequences. Because if one person who is expressing allegations of sexual misconduct is disproven and gaslit into thinking, well, that was a normal medical exam, so there you go, it creates a difficult situation into investigating further misconducts and allegations against the same healthcare provider because of the institution's way of kind of burying their stories and not listening and extending empathy to them. And again, like connecting to that is victim shaming. So especially in cases involving sensitive topics like sexual health, mental health, or gender identity, victims may already feel ashamed, confused, or worried going into that room, and they're worried that they won't be believed. And this makes it incredibly hard to come forward, especially if they don't have the proper language or support system to describe what happened. You'll notice, again, in the case study I'm about to talk about, there was a lot of advantage taken over athlete injuries, and something specific to that is, well, I mean, when an athlete gets injured, all they want to do is get better because of the passion that they have for their sport. And so that creates a difficult space where it is hard for them to say no because they want to heal fast. And then point 6 is that there is gaps in reporting. So while there are boards and systems in place to regulate these healthcare professionals, this level of enforcement varies. Some doctors who have been accused may move. They move to another state, they move to another province, country, whatever. They switch their licenses and continue to practice under minimal restriction in a new area. And the process to hold them accountable can be long, confusing, and re-traumatizing for the survivors of abuse. And a lot of, in general, for any sexual misconduct in and outside of this industry, victim shaming is very common, and therefore it's hard to even bring up your story because you've just been told that you're wrong and that your story is invalid and your experience is invalid, therefore nobody's ever going to believe you. So that makes it 10 times harder to step up and say something about the abuse that you faced. Now I want to spend the rest of this episode basically going into a case study. Some of you may have heard it, but it's the Larry Nassar case. Larry Nassar was born in 1963 in Farmington Hills, Michigan. In 1985, he studied his undergrad in kinesiology at UMichigan. In 86, he became a medical trainer on the USA Gymnastics national team. And then in 1993, he graduated as a doctor in osteopathic medicine. So when the Larry Nassar abuse really started boiling up in the media was around 2014. A graduate of Michigan State University named Amanda Thomas-Shaw filed a formal complaint that she experienced inappropriate physical contact during a medical exam with Nassar. Unfortunately for Thomas-Shaw, MSU ruled that his behavior was medically appropriate, resulting in no charges being laid for that incident. Then jumping forward to July of 2015, after USA Gymnastics CEO and President Stephen Penny reported the allegations of misconduct that were reported by another gymnast, Maggie Nichols, the FBI opened a full investigation into Nassar. Penny also provided the authorities with 3 other victims of this abuse that were willing to share their story. Then in August of the following year, so 2016, there was the first published investigative reports surrounding Nassar's misconduct during exams. In September of 2016, the Indianapolis Star published another article. This time, it was all about the allegations from 2 gymnasts and and formerly Nassar's patients, over allegations of sexual abuse from Nassar when they were children. Rachel Den Hollander and Jamie Danster. Jamie actually filed a civil suit against Nassar in California for this abuse. 4 days after this article from the Star was released, Nassar was fired from Michigan State University. In November of 2016, Nassar was charged with 3 counts of first-degree criminal sexual conduct, with 1 count involving a person under 13 in Ingham County, Michigan. He pled not guilty and was released on a $1 million bond. The state general said that these charges were only the tip of the iceberg of Nassar's abuse. In December, so only a month later, in the same year of 2016, Nassar was arrested on federal child pornography charges, with authorities saying they uncovered thousands of indecent and sexually explicit images of children between 2003 and 2016. Then the next month, in January of 2017, so this has already been 3 years of Nassar's abuse being in the public eye, 18 new victims filed federal lawsuits against Larry Nassar, MSU, and USA Gymnastics. They alleged sexual assault, battery, molestation, and harassment between the years of 1996 to 2016. Also in this month of 2017, Nassar lost his medical license. So after being alleged of sexual misconduct since basically the beginning of his career in the early to mid-90s, Nassar only got fired and lost his medical license in the early stages of the 2010s. So already we see this late reporting as well as long, drawn-out investigative processes. In July of 2017, Nassar pled guilty to all 3 counts of criminal child pornography, and then in 2017, he pled guilty to 7 counts of first-degree criminal sexual conduct in a plea deal. So in exchange, prosecutors would drop 8 more of the charges and not charge him for any more sexual assault incidents that occurred. But then a month later, in December of 2017, he was sentenced to 60 years in federal prison for his child pornography charges. Then jumping to the next month, January of 2018, a lot of things with this Larry Nassar case happened. On the 16th of January, there was a 7-day hearing where 156 victims gave very impactful and heartbreaking victim statements in Michigan. On the 22nd, all USA Gymnastics board members stepped down after pressure was put on them from the Olympic Committee. On the 24th, a judge sentenced Nassar to 70 to 175 years in prison. The judge, Rosemary Aquilina, was quoted saying, "I just signed your death warrant." As well, MSU President Lou Ann K. Simon stepped down. In her resignation letter, she was apologizing to victims for facing the evils of Nassar's abuse that she didn't attempt to stop. And then on the 31st, Nassar pled guilty to 3 counts of criminal sexual misconduct involving females aged 13 to 15, and another with a female that was under the age of 13. This man, who at the time of this abuse was well into his 40s, was abusing girls younger than 13. I'm 16, and I'm still very young. And an adult man sexually abusing a child is so disgustingly wrong, and it makes me so internally upset that I don't really know how to express that in a graceful and concise way on here. So all I have to say is that's fucking disgusting. And then as well on the 31st, 60 other women came forward with victim statements, totaling the abuse allegations against Nassar to 256 victims. Think of that number. 256 athletes and students who were under Nassar's medical care were abused. In February of 2018, Nassar was sentenced to 40 to 175 years in prison to be served concurrently with the sentence that were already given from the child pornography charges. And then in the following month of March, there was a $500 million settlement from MSU for all of 332 victims total. So even from the last day of January in 2018 to March, the victims grew by almost 100. Seeing this, you can almost assume that when one victim stands up, the rest are empowered to tell their story. And so I think in the midst of all of this crazy, disturbing allegation legal world, I think it is very, very powerful that these women were able to band together and stand up against a monster. I think that is the community that women are, and I hope the community that women continue to be. And then in August of 2018, Nassar's appeal of the 60-year sentence for child pornography charges was instantly rejected. No surprise there. Jumping to now July of 2021, the U.S. Justice Department Inspector General Michael Horowitz issued a scathing report accusing the FBI of botching the investigation 6 years earlier and thereby allowing the abuse to continue unchecked. So now we're seeing the point of, well, they're not taking the time to thoroughly and carefully investigate these situations, and that small little thing, as much as it seems small, has great negative impact on all the victims of this abuse. In September of 2021, some of the biggest names in gymnastics, so Simone Biles, Aly Raisman, Michaela Maroney, Miss Nichols from the some previous cases with Nassar, testified about the abuse that endured under the supposed trusted hands of Larry Nassar. Simone Biles pointed out that this abuse was a systematic failure that, quote, enabled and perpetuated his abuse. Jumping to April of 2022, 13 more women claiming to have experienced sexual assault at the hands of Larry Nassar filed a lawsuit seeking $130 million from the FBI for failing to act quickly on their accusations of sexual assault earlier on and failed action that enabled Nassar to continuously abuse young athletes. Again, a lack of care and a lack of investigation will lead to great negative impact. In June of 2022, Nassar's final appeal on his sentences was rejected in Michigan Supreme Court. And then in July of 2023, Nassar had been reported as being stabbed multiple times while in federal prison, but remained in stable condition. So one question over me researching this case was what kept enabling this abuse? And it starts with people. People meaning those who sit in higher authority. So in this case, it's the Michigan State University staff and the FBI. They did not take victims seriously. They didn't attempt to look further into this abuse in the early stages when they were getting small accusations of sexual misconduct. They did not want to conduct extensive investigations early on, which in turn, if they had, could have prevented the abuse against hundreds of other women. And some of my other personal questions around this is why didn't his medical license be revoked sooner? If he was getting allegations of sexual misconduct in the late 90s, why, if that was investigated properly, why wasn't his medical license taken away sooner? And my second question is why didn't Michigan State University staff push for further inquiry into these allegations? Clearly, these girls are not lying. If you have 10 people telling you the same thing, it's probably happening. So why did MSU not take that opportunity to push for further investigation from the FBI into Larry Nassar, which again could have further prevented this abuse from happening for years to continue? Now I want to talk about what steps could be taken, systematically, societally, personally, anything, to ensure that patients, specifically female patients, are safe while in the hands of healthcare professionals. Number one is mandatory chaperones for intimate exams. What this means is a trained staff member that is of the patient's choosing is present during any physical exam involving the chest and breasts, genitals, or other sensitive areas. This matters because it protects both the patient and the doctor, creating transparency and deterring misconduct. a bonus to this is patients should always be offered the option and encouraged to request a companion without being shamed into it. Number 2, there needs to be clear, verbal, informed consent before touch. Consent in anything in life is so important, but especially in intimate medical moments, you need informed consent. That means it is explained clearly before what's going to happen. It's agreed to by the patient with informed consent and followed with the opportunity to ask questions or even say no. This matters because it reinforces autonomy and gives autonomy back to the patient and ensures that touch is never assumed. Touch is never ever assumed. In any situation in life, touch is never assumed, but especially in a medical exam, it is never ever assumed. Even as standard practices like placing a stethoscope on a person's chest or examining someone's abdomen, this should be a standard practice, and I hope that it is. But I mean, I'm not consistently in a medical office or a hospital, so I wouldn't know. But I hope that continuing from this case and other cases of medical misconduct, informed consent becomes a priority in every medical exam. Number 3 is that there should be standardized documentation of all physical contact. So doctors should document what was done, why it was done, and how the patient responded to ensure that there's a paper trail if these medical boundaries are crossed. Number 4 is really important. It is trauma-informed training for all healthcare workers. This includes recognizing signs of past trauma, communicating gently and respectfully, so again, respecting boundaries, and avoiding triggering language or abrupt physical contact. Again, there's where our informed consent comes in. Trauma-informed care makes providers more human and less mechanical. Therefore, it saves lives. And saves many people from traumatizing medical experiences. Number 5, there needs to be safe, reliable, and anonymous reporting channels. Patients must have access to easy, anonymous, and judgment-free ways to report misconduct if it occurs. These channels must lead to actual investigations and include third-party oversight, so not just internal hospital review, but get an outsider's perspective on the situation, and offer legal and emotional support for the patient/victim. It's so important, and I love the word reliable in here. I added this in as I was finalizing this episode, but reliable is a really key thing. You can have something that is safe and anonymous to report misconduct, but if it's not reliable or even checked, what is the point, right? What is the point of having that channel if it's not upkept, you know? And there also needs to be strict accountability and no tolerance policies. So healthcare workers found guilty of this kind of abuse should not be quietly transferred or allowed to resign. There must be immediate suspension pending investigation. Again, that's what I said. Why wasn't Nassar's medical license revoked sooner? And then, again, the revocation of licenses if this abuse is confirmed, especially in fucking court cases. And then there needs to be transparency to the public about the disciplinary action following this abuse. And a question I've added into this section is what could have been prevented if there was policies and accountability policies like this in the time of Larry Nassar? How many people, how many women could have been saved if there was stricter no tolerance policies? And number 7 is education for patients, and this starts young. Teaching girls, and I guess all patients, how to advocate for themselves in medical settings. Because again, we know it's intimidating because there is someone in the room that is supposed to be all-knowing and giving you the answers for the issue that's in front of you. And so letting patients know that they can say no at any time. They can ask for a different doctor. They have the right to bring someone in the room with them to appointments. And this can be built into school health curriculums and youth programs, constantly instilling the importance of informed consent as well as the importance of saying no when you need to. But this doesn't just start with the daughters. Remember the saying, educate your son, not teach your daughter. It is very important to teach everyone to say no, but it starts at education. And for both parties and both sides. Number 8 is something that I'd really like to see, but it's more women in leadership roles in medicine. So having these diverse female-identifying professionals in positions of power helps shift institutional priorities and creates safer, more empathetic systems. And the last way that we could change the narrative around safety at the hands of healthcare professionals is normalizing speaking up and asking questions. Culture shift matters, and medical settings need to encourage patients to ask about their procedures, pause exams when they need to, or question every single thing that's going on. Reinforce that curiosity is not a sign of disrespect, it's a right. Again, informed consent. I know this was a heavy episode, but thank you so much for listening to another episode of Project Honesty. You can check us out on social media. Our Instagram is project_honesty24, our TikTok is project.honesty, and our website is linked in our Instagram bio, and we are available for listening on Spotify and YouTube. If you enjoy listening to Project Honesty, share us with friends and family, and you can direct them over to the Spotify, YouTube, Instagram, website, or TikTok to help them learn more. Remember to subscribe, follow, and click the bell icon for updates when I post. And remember, the more listeners, the bigger the family.